Good day everyone, I am Lady Suzanne Picabal and I am here to discuss my case study entitled Infertility. Let's start. Infertility. What is infertility? It is a condition where you cannot get pregnant after 1 year of trying to conceive. So this is a complication of both female and male genders where they have the struggle to get pregnant. In women, cause of infertility can include endometriosis, uterine fibroids, and thyroid disease. Men with fertility problems may have a low sperm count or low testosterone. The risk of infertility increases as you age. So when you get older, especially for women, it is very hard to get pregnant, especially when you are at the age of 35 above. It is very hard to conceive in that age because of the changes of your body that may interfere with your reproductive system, especially when you have those mentioned diseases. There are two types of infertility include primary, which is a woman who was never pregnant and who cannot conceive after 1 year of not using birth control. So this primary infertility, these two types, the primary, in this stage, the woman is not pregnant or cannot conceive after 1 year without using any birth controls or pills. Secondary infertility occurs when a woman can get pregnant again after having at least one successful pregnancy. So secondary, in which a woman cannot get pregnant even though she already has experience being pregnant. So that's the two types of infertility. What are the causes for pregnancy infertility? For pregnancy to occur, every step of the human reproduction process has to happen correctly. The steps on this process are: 1 of 2 ovaries releases a mature egg. So a woman must have 1 or 2 ovary releases a mature egg. Second is the egg is picked up by fallopian tube. In men, sperm swim up the cervix through the uterus in the fallopian tube to reach the fertilization. So this is the woman also the egg. The next, the fertilized egg travels down the fallopian tube to the uterus. The next, the fertilized egg attaches or implants to the inside of the uterus and grows. In women, a number of factors can disrupt this process at any step. Female infertility is caused by 1 or more factors below. So those are the steps or process that the human reproduction process has to happen. But there are many ways to disrupt those processes. By mostly they cannot occur because of diseases present in a woman. So let's move on to the risk factors. What are risk factors for female infertility? Certain factors may put you at higher risk of infertility, including age. So as I said, age really includes to infertility. The quality and quantity of women's eggs begin to decline with age. So that's the reason. Because of changes in your body, especially when you age. Then smoking. Besides damaging your cervix and fallopian tubes, smoking increases your risk of miscarriage and ectopic pregnancy. So it can increase by simply smoking. It can damage a lot more in any parts of your body. And being overweight or significantly underweight may affect ovulation. Getting to a healthy body mass index or BMI might increase the frequency of ovulation and likelihood of pregnancy. Then sexual history. Sexually transmitted diseases such as chlamydia and gonorrhea can damage the fallopian tubes. Then alcohol. Excess alcohol consumption can reduce fertility. Then in men, what are the risk factors of male infertility? These factors can cause female infertility: enlarged veins or varicocele and scrotum, the sac that holds the testicles. Genetic disorders. So genetic disorders like when naasali kalahi nga kanang dili gyud or infertile gyud, so that's kanang usual to happen yun sa iya expected. Then such as cystic fibrosis, high heat exposure to testicles from tight clothing or frequent use of fat tubes or sauna. So male mas kanang iwasan gyud ang pagkuan gyud ay pag ato sa mga sauna, sa mga init nga areas kay maka-affect pud ni sa ilahang kanang sperm counts. Low sperm count or low testosterone, hypogonadism. Then misuse of anabolic steroids, then premature ejaculation or retrograde grade ejaculation, semen flows back into the bladder. Then testicular cancer and treatments, and undescended testicles. So those are the factors that may affect the infertility or fertility of a male. Let's move on to the complications. So the complications are the following to both sex and sex with infertility problems. So these are for both the eye. So di lang sa woman or di lang sa laki. So again, age, especially age of a woman, like I said before, then age also of a man. Then duration of infertility. So then gynecological history. Does the woman have a regular menstrual cycle? Then monorrhagia. Heavy regular bleeding may suggest the presence of polyps or uterine fibroids. Severe dysmenorrhea, painful periods. Then irregular menstruation such as irregular or absent ovulation. Those are the complications. Let's move on to medical care that a man and woman can are mga tests for men and women. So let's start with tests for women. Fertility for woman relies on the ovaries releasing healthy eggs. The reproductive tract must allow an egg to pass into fallopian tubes and join the sperm for fertilization. Normally nga ito yun mahitabo nga. Once the sperm arrives to the uterus of the woman, so muadto gyud siya sa kanang ovaries. Then the fertilized egg must travel to the uterus and implant the lining. Test for women infertility try to find out if any of these processes are impaired. You may have a general physical exam. So one physical exam including a regular gynecological exam. Specific fertility test may include ovulation testing, which a blood test measures hormones levels to determine whether you are ovulating. So ovulation testing. Second is hysterossalpingography. Hysterossalpingography evaluates the condition of your uterus and fallopian tubes and looks for a blockage or other problems such as X-ray contrast is injected into your uterus and an X-ray is taken to determine if the cavity is normal and to see if the fluid spills out of your fallopian tubes. So that's next is the ovarian reserve testing. This testing helps determine the quantity of the eggs available for ovulation. This approach often begins with hormone testing early in menstrual cycle. Then, other hormone testing tests check levels of ovary hormones as well as pituitary hormones that control reproductive progress. Then there's a lot more such as imaging tests. Depending on your situation, rarely your test may include also the hysteroscopy, laparoscopy, and that's all for the woman test. Then let's move on how is female infertility treated. So how is it treated? There are available. So first is the medications. Fertility drugs change hormone levels to stimulate ovulation. Then surgery. Surgery can open black fallopian tubes and remove uterine. Treatment of endometriosis doubles a woman's chances of pregnancy. Then, how is male infertility treated? Treatments for male infertility include medications also. Medications can raise testosterone or other hormone levels. There are also drugs for erectile dysfunction. Next is surgery. For men, need surgery to open blockages in the tubes that store and carry sperm. Varicocele surgery can make sperm healthier and can improve the odds of conception. So those are the options on how infertility can be treated. Then, are there any prevention? So there are prevention. How can I prevent infertility? Take these steps to protect your fertility, especially while you're trying to conceive. So these steps are to eat well, balanced diet, and maintain a healthy weight. Don't smoke, misuse drugs, or drink excessively. So we must refrain from those vices, Then get treated for STDs. That's very important. Then limit exposure to toxins. And most of all, stay physically active but do not overdo exercise. So we must also know our limitations. So that would be all. I hope you understand my case study. And I hope you get some knowledge about it. And I hope that it can help you in the future. Let's spread awareness and stay positive. Thank you.